Right. So for any anatomical region, the normal thing to do would be to start with skin. Right? And the skin of the neck, you describe its innervation, you describe its landmarks. And so skin in the neck, it's thin skin, right? It's thin skin that is normally under tension, meaning to say you don't necessarily see skin folds in the neck because the skin in the neck is normally under tension, right? And they're what we call cleavage lines. Let me try draw on this one that is visible here. They're what we call cleavage lines. For example, the one that is going in that direction. Cleavage lines are natural lines that follow collagen, in on which, if you're to make an incision, you cut following that cleavage line. You don't cut across it because you have poor wound healing. Right. So just as a general question to see if any of you had read anything about this, what innervates the skin of the neck? For the benefit of everyone, I will use English throughout. What is the skin of the neck?
C2, C3, and C4.
So we have nerve roots C2, C3, and C4. Depending on whether we're talking about the front or the back. Remember, a spinal nerve divides into anterior ramus and a posterior ramus. Anterior rami are what innervates the skin of the anterior regions plus your limbs. Then posterior rami innervate the skin of the back. Right. So yes, we have C2, C3, and C4 innervating the skin of the neck. Why not C1? Why start C2? Why not cervical nerve number 1? Anyone know?
Some people don't have C1, and if they have the C1, it won't have all the rami, and
People don't have C1.
It's more centered.
No, so people do have C1, but I think what you're trying to say is there's a state which goes like in 50% of the people, C1 does not have a dorsal ramus. But for cutaneous innervation, C1 has no cutaneous branch. Even though it has an anterior ramus C1, that anterior ramus does not give a cutaneous branch. Then the natural landmarks that we see on the neck, I don't know why this diagram is a bit bad, but the natural landmarks that we see on the neck, there's a muscle that goes, this diagram is not so visible because I don't know why, but this muscle that starts here, coming all the way to the back. I'm sure if you see old people, you see a very prominent muscle in the neck that starts from somewhere lower down here going to the back here. It's what we call the sternocleidomastoid. We'll talk about it shortly with when we start to talk about the triangles in the neck and how we divide them. Right. Then after skin, in every region, we go to superficial fascia. Superficial fascia is a very thin layer of areolar connective tissue. And in that superficial fascia, we find superficial veins as well as a muscle. The muscle that we find in the superficial fascia of the neck is this muscle here called the platysma. So when you do face, the muscles of facial expression are innervated by the facial nerve, right? This platysma muscle, though in the neck or on the neck, this muscle helps us with facial expression because it comes to insert into the lower jaw. Right. So this muscle, in terms of innervation, it's also innervated by the facial nerve, which innervates our muscles of facial expression. Right. So this is a quadrilateral muscle where it originates. The bad thing now is you guys start with head and neck, but there's a muscle here on the chest wall, which we call the pectoralis major muscle, right? There's also a muscle on the arm, the upper lateral aspect of the arm, known as the deltoid muscle. These two muscles, the pec major and the deltoid, they are covered by fascia. So there's a deltoid fascia and there's a pectoralis fascia. It is from these two sets of fascia that this platysma muscle will originate. In terms of insertion, it's going to the lower jaw there. And so it's inserting into the lower body of the mandible. And this muscle, we said it functions just like the muscles of facial expression, because for any given muscle, origin is fixed, insertion moves towards origin. So it's going to work in the expression of being surprised, or you are trying to open your mouth and in case you have seen maybe a horror or something, kushamisika. Right. So this platysma muscle is part of the muscles of facial expression, though it's in the superficial fascia of the neck. Right. Then the cutaneous nerves that I say they innervate the skin, they also move within this superficial fascia. Not yet. And those cutaneous nerves, can't really find a diagram as yet, but those cutaneous nerves, remember we said they'll be coming from C2, C3, and C4. And there are 4 of them. The 4 that I want to mention, they innervate the skin of the neck on the anterior side and the sides. So it innervates the skin of the neck on your anterior surface of the neck and the sides. There are 4. One is called lesser occipital nerve. I'll show you the nerves when I do the plexus. The plexus is soon. But there is lesser occipital nerve. Then there is greater auricular nerve. Then there is transverse cervical nerve. Then there is also supraclavicular nerves. I'll show you those nerves when I do the cervical plexus. Okay. Then also in your superficial fascia, we find superficial veins. And the superficial veins that I have in the neck are, number 1, the external jugular vein. Number 2, the anterior jugular veins. So for veins, what you need to know is because veins are forming towards the heart. So you want to know how you form a vein and how does it end. For example, which 2 veins are going to join to form the external jugular vein? Then where is that external jugular vein going to drain into? So for us to form external jugular vein, it is the union of a vein called posterior auricular vein and another vein called the posterior division of the retromandibular vein. So posterior auricular vein plus posterior division of retromandibular vein, they join and they create the external jugular vein. This external jugular vein lies in the superficial fascia in the neck. How it ends, external jugular vein will end by draining into another vein called the subclavian vein. So when we then start to do the triangles shortly, when we do posterior triangle, there'll be a subclavian triangle there, where in the subclavian triangle, we'll see the subclavian vein. It is within that triangle where we will see external jugular vein going to drain into subclavian vein. So far, I'm just saying the things in the superficial fascia, but when you then look at the triangles and dividing our neck into specific triangles, that's where we're now going to see maybe a subclavian triangle where there's the subclavian vein. Within that subclavian triangle, that's where I'm going to have drainage of the external jugular vein into the subclavian vein. So far, are we still together?
Yeah.
Okay. Then, so remember you'll be having a left and a right. Then near the midline here, we have what we call the anterior jugular veins. And these anterior jugular veins, they start off as continuation of veins that we call the submental veins. Right. So the submental veins will join and they create your anterior jugular veins. Right. And these anterior jugular veins, I want you to notice something. Lower down here, it's as if they join each other. They form this arc here that we call the jugular venous arc. So your anterior jugular veins are joining and they create your jugular venous arc. Right. So the veins in our superficial fascia, it's external jugular vein, then it's also anterior jugular veins. Right. So far, so good. Okay. Any questions so far?
Was still okay.
You're still okay. 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 Then we've been describing superficial fascia. Then something that we also find in the superficial fascia, the bad thing is it's not really shown by most pictures, but we have what we call the superficial lymph nodes. The lymph nodes that we find in the superficial fascia, most of them are not shown by these atlases or what, but maybe this one will try to give us a better view. So here's a very easy way to remember. Right. The lymph nodes, most of them are situated at the junction of the of the head and the neck, meaning somewhere here. And they form something that we call a cervical collar. It's like a collar in your neck. They're forming a collar of lymph nodes that surround the junction of your head and the neck. Right. So near the front here, in the submental region, it will make sense when I do the triangles to say which region is the submental. We have what we call submental nodes. Then just lateral to them, we have what we call submandibular nodes. Just in front of the ear here, we have what we call superficial parotid nodes or preauricular nodes. Then just behind the ear, we have what we call retroauricular nodes or mastoid nodes. Then in the occipital region here, where we have the occipital bone, we have what we call the occipital nodes. So it's like I'm having a collar of lymph nodes around my junction of the head and the neck. And these lymph nodes are also in the superficial fascia. And they are not really draining structures in the neck, but they drain structures that are specific to the region where we find them. For example, the occipital nodes would drain structures of the back. Right. And if you ever learn about rubella, which causes German measles, it is also a teratogenic virus. It causes problems with embryological formation of babies. Those people would come with swollen occipital lymph nodes, which you can actually palpate. So lymph nodes, they clean the lymph fluid for infections as well as other diseases, meaning they can be the first sign of disease. Someone presents with a lymph node swelling or a lump, then they can tell you maybe the person is battling maybe with TB or something. Right. Okay. Would you want me to then say what do these specific lymph nodes drain, or we can skip that for now? Which is which? I can.
Yes, please.
I can. I'm not hearing you.
Yes. Yes, you can.
Oh, you want me to tell you what they drain?
Yes, please.
Okay. Submental nodes, they drain the chin, then they also drain the tip of the tongue, like the tip of it, the most anterior portion of your tongue. These submental nodes, the most anterior ones. Right. Then, excuse me, the submandibular lymph nodes, they drain the mid face, basically the greater part of your face, right? And they also drain structures in the submandibular region, to include your submandibular salivary glands. Then parotid nodes, the ones that lie in front of the ear, they drain the scalp in front of the ear, as well as the parotid gland itself. Right. They'll also drain the ear. They'll also drain things like the eyelids. So you're just thinking of everything closer. The parotid is somewhere here. So eyelids, the cheeks, the ear, the parotid itself, and the scalp. Mastoid nodes behind the ear, they'll drain the ear, then they'll also drain the scalp behind the ear. Right. Then the occipital nodes that I said were palpable in German measles, now known as rubella. They drain structures from the back region here. So anything in the occipital region, it's drained by these occipital nodes. So we have seen superficial fascia. There are lymph nodes, there are cervical nerves, there are superficial veins. We also said there's a muscle in that superficial fascia, which was the platysma muscle. Right. If you reflect superficial fascia, if you cut, the next layer that we come across is the deep fascia. And the deep fascia in the neck is divided into 3 or maybe 4 if you want, but let's use 3. Okay. Does anyone want to hazard a guess on the layers of deep fascia that we find? The 3 layers of deep fascia.
It's near the investing layer, the pretracheal layer, near the prevertebral.
Yes, then what's the 4th one then?
And dizzy.
The carotid sheath. So deep fascia in the neck has 3 layers. The one from the most external, we have what we call investing layer of deep cervical fascia. We call it investing because it invests structures and it does it in 2s. To invest 2 muscles, 2 glands, 2 spaces, whatsoever. I'll talk about it shortly. Then after this investing layer of deep cervical fascia, I have a layer that I call the pretracheal layer of deep cervical fascia. Pre means before, meaning if it's pretracheal, it is before the trachea. So the trachea is not enclosed within pretracheal fascia because the fascia is in front of the trachea, because we're calling it pretracheal fascia. Then the fascia that is deep, which is closer to the vertebral column, is what we call prevertebral fascia. Right. Then at some point, those 3 fascias that I've mentioned, investing layer, pretracheal, prevertebral, they will merge and create a carotid sheath. Within the carotid sheath, we'll find the common carotid artery, the internal jugular vein, and the vagus nerve. Those are the 3 main components that we find in that carotid sheath. Internal jugular vein, the vagus nerve, and the common carotid arteries. But if you read further, it will tell you that the common carotid will divide there into internal carotid and external carotid. So at some point within the sheath, you have internal carotid and external carotid. It will also tell you that in the upper part, remember vagus nerve is cranial nerve number 10. It tells you that in the upper part of the carotid sheath, you have the lower 4 cranial nerves, which is 9, 10, 11, and 12. Glossopharyngeal, vagus, accessory, and the hypoglossal. But over time, you are left with only the 10th one because the rest will leave. That is why most people will just then say the main contents of the carotid sheath are the internal jugular vein, the common carotid, and the vagus nerve. So I'm not going to tell you the attachments of these fascia because we'll spend 2 hours talking about their attachments, because they have superior attachments, inferior attachments, basically the whole head and neck. So I won't dwell much on their attachments, but I would love to know what they invest or what they enclose. Starting with investing layer of deep cervical fascia. This is the one that I said it encloses things in twos, right? So it encloses two muscles. Which two muscles are they?
Trapezius and sternocleidomastoid.
Right. So you have sternocleidomastoid on the anterior aspect, anterolateral rather. Then you have trapezius towards the back here. So there are two muscles that are enclosed, excuse me, which is your sternocleidomastoid as well as the trapezius. This investing layer of deep cervical fascia, it forms the roof of two triangles. The two triangles in the neck are the anterior triangle and the posterior triangle. Meaning to say, investing layer of deep cervical fascia, when we do the triangles, for every triangle, we'll be saying the roof, there is investing layer of deep cervical fascia. Right. Then this investing layer of deep cervical fascia, it encloses two salivary glands. And the two salivary glands that it encloses are, number one, the submandibular salivary gland, which produces the most saliva, by the way. Then it also encloses what we call the parotid salivary gland, which is the largest gland, though it doesn't produce the most saliva. Out.
Yeah.
Okay. And then this investing layer, remember I'm saying things in twos. It encloses two spaces. Which spaces are these? There's a space called suprasternal space, which is above the sternum. The sternum is your breastbone here. You have a sternum here, right? So there's a space on top of it, which you call the suprasternal space. That space is where the two anterior jugular veins are going to meet to form that jugular venous arc that I was showing you, right? Then the other space that is enclosed by that investing layer is what we call the supraclavicular space. Right. Then there are two muscles that we're going to see when we do the triangles in the second session, where there's an anterior belly and a posterior belly, or there is a superior belly and an inferior belly. There has to be a fascial pulley that joins those things, right? The fascial pulley that joins those things is coming from this investing layer of deep cervical fascia. And the muscles are the digastric and the omohyoid muscles.
Ernest,
Yes.
what do you mean by fascial pulley?
Okay, let me draw something here. I have an anterior belly here, right? Then I have a posterior belly there. Right. So these bellies are joined by a fascial pulley like this. This pulley will suspend somewhere, maybe on a bone. It's just a pulley that's joining the two things together. Like how best can I put it? You've ever drawn water from a wall?
Yeah?
Have you ever drawn water from a wall?
No?
It's hard. Okay, I'll show you a picture when we get there.
Okay.
Then that's investing layer. Then pretracheal layer encloses what? So pretracheal does not enclose the trachea. I think I tried to mention that, right?
Mm-hmm.
What is actually enclosed in the pretracheal layer is the thyroid gland. It's one of your endocrine glands on the neck. Right. Then the prevertebral fascia, when we do the posterior triangle of the neck, the prevertebral fascia will actually cover the muscles that form the floor of the posterior triangle of the neck. It forms something that we call a fascial carpet. Right. It's just going to form the floor of the posterior triangle of the neck. Right. Then when you do your upper limb, or maybe today, I'm not sure if we'll do it today, but there's something called a brachial plexus that starts in the neck, goes to the axilla, then the upper limb. That brachial plexus, when it leaves the neck, it carries with it a layer of prevertebral fascia into the axilla that we call the axillary sheath. So prevertebral fascia would take part in the formation of the axillary sheath. Right. The axillary sheath is where I'm going to find the axillary artery and the cords of the brachial plexus that I'll show you when we do the plexuses. But we don't have the axillary vein there. Depending on the book that you use, most books say the vein is not there. Right. Right. So this does it for introduction to the neck before we move to the triangles. Right. Any questions so far, or I can be moving?
Questions?
Yeah, you can move.
I can move.
Yes.
Okay.